Hello everyone. Welcome to AIPT USA, your one-stop shop to learn all about assessments and treatments of different body parts in an evidence-based format. Here in this section, we're going to talk about the hip. If you have followed the series, you must have seen the ankle, the cervical spine, or other joints and areas. Now, we're going to focus about hip. The common conditions that can walk into your clinic with hip problems are groin pain, a snapping hip, unstable hip, IT band syndrome, trochanteric bursitis. These are just medical diagnoses that you can think of where you have to focus on the hip. So the treatment options that you have, as you can see, I put it here. If you don't have a suspension, that's okay. You can use a band or something that hooked on, or a towel or a blanket that you can hook up to the table, or somebody holding on to it, or other stuff that you can think of. Be creative. But I'll show you different options that are very helpful. One, a technique I'm going to teach you is a lumbosacral manipulation technique. This is useful in the lumbar spine and also in hip conditions or groin pain, but also distractions, which I'll show you with the belt. In this one, I have the belt placed close to the groin area at medial possible for the pressure. So you want the patient with their knee bent. You want it as close as possible. You want to stay away. Pull and see if that's comfortable to them, if that alleviates their symptoms, feels better. Ask them to do hip flexion, bring the knee to the chest. That'll be mobilization with movement if that makes them feel better. I can also do rotations. I can go external and internal rotation. As you can see, I still maintain the pressure. This is one of the treatment options you can do with your patients to improve their mobility. You can go a hip scour or a quadrant of the hip with pressure if this alleviates their symptoms. Because remember, the whole theme of this is to identify the concordant sign and see what alleviates the concordant sign. This is one of the options. The other options, usually, on the medial side of the hip, a lot of patients complain of a lot of stiffness, tightness, and pain. Cupping is one good option. I do like it. I just cup the medial area on the adductors area. Just put my cups on. And I always prefer to do active motion with my cups on. These are not passive techniques. I would definitely want them to be active. So they can just do a bend knee fall out where they'll feel the pull. You don't want them to take the foot off. Then that won't be very useful. Or you can do it this way. But I like it this way. So we're going to go out where they feel a little pull. Do you feel a little pull down there? Yes. So you want them to move. You don't want them to fall off. You can put a towel or a pillow so they can feel the end range of motion. We'll talk about those different advanced techniques later, but this is one of the treatment options you can use. You could also use ISTM to treat the areas. That's also effective. So the way to do it is use your tool. I typically use the large tool. You can use the whole of the lateral because the trochanteric bursitis or your groin pain is influential because of lack of glute control and lot of activation on the lateral part of the hip. So you can use the tool by putting pressure in multiple directions. But as you can see, the goal is to do multiple directions, but the pressure is even when I go all the way up or all the way down. I'm not doing brush and then stroke. You can do a little brushing first to desensitize, but I like to apply pressure in these large areas. So that's one treatment option you have. Then cupping and ISTM, the ones I like the most as exercises for the hip because that's what teaches control. This usually helps me to deload the tissue. They can use it as a method where they rely on deloading the tissue, where they keep their knee bent. Now they can do rotation where they're stabilized. So I can improve their rotational stability because they're not loaded. The tissue is much more comfortable to do it. I can bring it closer. I can make it in such a way so they are in a bent position. Now they can rotate or they can put it down and move it in and out. So they have a reference points to move. They don't feel like they're going to fall off, but at the same time improve mobility. You can put a blanket which is tied up or somebody holding. They're all different options you could use. I prefer to do it in prone also, so if you could go on prone, because glutes are the biggest problem for hip dysfunction. And that's when you use the IHTM tool on the glutes to activate. That's when I would use it faster, like real fast, to improve the facilitation. And on the hamstrings, I would do a slow stroke to improve mobility. And same thing with the lateral hip. I could also use cupping on the posterior aspect and also on the glutes for facilitation, like I showed you before. As I said, one manipulation technique that works wonders for hip pain, low back pain, and knee pain is one rotational manip, which I'm going to demonstrate now. Go ahead and lay on your back again. So with this technique, if I have to get rid of this so you can see better. In this technique, we have to move the body part in such a way. You can do it on both sides, so don't worry which side you're going to do. Just move your legs out of the way. Ask them to cross their arms across your chest. You make a V. So they are in a pattern where they're in a V where the patient is not helping you. You are doing the motion. So you're going to put one hand on top of the iliac crest and ASIS junction. Where you're going to put that hand, the palm of the hand, and hold it. Tell them that you are there so they're aware of what you're going to do. You're going to pull them away from the V. So they're going to pull them towards you. So you're going to put all your left hand or the pulling hand under them. And you want to turn them to the point that you feel a pop or a click. If you don't feel any, it's okay. Go to the end and hold it. And just small motion. You don't want to pull them hard. You want to go to the end and hold and gentle push here. That's all you have to do. You can do it on both sides. So I'm going to show it on the other side too for reference. So you go all the way, make a V on that side. The patient is not helping, you are doing the motion. A complete V. So they have a point right about there. You're going to put your hand on top of the iliac crest. Put your hand all the way under. And make sure you turn them towards you. Do not pull them off. You want to make sure you maintain that. So you want to put your hand under. Control that. Turn them. And that's it. So you turn to the point that you feel a let go or a click or a pop. If not, go to the end and hold and a gentle pressure here. And this is a very powerful technique. It helps with patients with low back pain, hip pain, and knee pain. It works well if you have groin pain. So I want you to kind of use one of these treatment options to help your patients with the medical conditions or hip dysfunctions that you identified to have concordant sign. I hope this video was helpful. And there'll be more videos for you to see for different areas for treatment. If you like our videos or if you have comments, please post below. And I hope you all have a good day.